if you take the tea over a long period of time, you get great result.
So there's some long-standing results here.
Every herbal treatments are basically a long-term treatment.
And now I noticed there's a lot of sediment in the tea. Am I supposed to eat that?
Some people find the taste very awful, but you get accustomed to it. But if you don't take the sediment, you can rebrew it. At least.
So once you've consumed the tea, you reuse the sediment again in the next batch?
Yeah, and then you can rebrew it 2 to 3 times.
So this is becoming very economical because you've already said the herbs are extremely inexpensive.
So 1 month supply, you can get $10 and most $20.
Okay, so 1 month supply of a natural diabetes remedy, $20.
$20.
Can't beat that.
And then I'm excited about this formula, not because of its cheap price, but because of its safety.
So say more about that.
Compared with pharmaceutical drugs, this is way, way safer. It doesn't have any side effects.
Hold on a second here, because this is incredible. What you're saying, that this natural remedy, this formulation you can make yourself for $20 a month is safer than a pharmaceutical prescription
That's what
you're
I'm
getting
saying.
From your doctor.
A lot safer. They don't have this herbal treatment have no side effects.
So no side effects.
And then this formula is known to have no resistance developed. So
you don't have to increase the dosage.
No.
So okay, let's talk turkey here. What about scientific evidence?
There's an irony here, because this formula has been known so well. People don't see too much need to prove it again scientifically.
So no economic
benefit
reasons, is what I'm hearing.
So patent is impossible because everybody already knows it.
Right.
So because this is not patentable, nobody wants to invest. So because this is too well known, ironically, there's a bit little science about this product.
Right.
But compared with this 6-flavor tea, P700 is very well studied.
Right, that's what I was going to ask. How does this 6-taste tea compare with P700?
In terms of the quality and quantity of scientific research, P700 is way, way above this 6-flavor tea. And then especially the long-term effect of P700 on diabetes is well established, while the studies on the long-term effect of this 6-flavor tea is still some way to go before very well established.
Sounds like there's just not a lot of money there to support doing
correct.
Further studies.
Yeah, so that's the fate or many herbal treatment face actually. It is not patentable, so nobody wants to put money
But you
there.
have confidence in this 6-taste tea.
I strongly recommend.
Right.
And then the safe and cheap, no side effects.
Safe and cheap and no side effects.
Yeah,
that's
and
what we want to hear.
Before these pharmaceutical drugs, I say people should try this.
Right. Okay. So let's talk about the other remedy you mentioned briefly. I believe
Indian treatment.
Indian treatment, Pterocarpus marsupium.
You are doing very well.
Thank you. Thank you. So this is an Indian treatment, and you used a word on the break, Ayurvedic.
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 Ayur means in ancient Indian language called life. Vedic means from Veda, which is a way. So it's a way of life.
Way of life.
Yeah. So it's a word that describes traditional Indian medicine science.
Right. And so how does this, can I call it PMT?
Yeah, Indian Kino.
Indian Kino. So how does this differ from the 6-taste tea in terms of its applicability to, you mentioned type 1 diabetes and type 2 diabetes?
Yeah, there is actually a very particular reason why I'm quite excited about this Indian Kino, PMT.
Right.
I believe some of their claims about its effect on type 1 diabetes are convincing.
Right, so we've been focusing a lot of the show on the type 2
diabetes. Yeah, because P700 is mainly for type 2 diabetes.
Right, okay.
But even though
the impact on type 1.
Yeah, even though we say P700 is for type 2 diabetes, some desperate type 1 diabetes patients actually use P700 diabetes.
And?
So far, no person has been cured of type 1 diabetes.
Nobody has become, as you say, normal.
Yeah, so there are many, 70% of the users become normal when they have type 2 diabetes.
70% type 2.
Yeah, but no one with the type 1 diabetes became normal.
Right.
But they succeeded in reducing their daily insulin requirement by 60 to 70%, which is
So
quite
significant.
good. Yeah, but the is significant, but not normal.
So it doesn't do the same as it does for type 2.
Yeah, P700 is basically for type 2 diabetes.
Right. Okay.
But,
so let's talk about this PMT.
Yeah,
you were
the
saying it has an impact on type 1.
Claims of this pterocarpus marsupium on type 1 diabetes, I have reasons to believe them. So
significant health benefit to type 1 diabetes.
That's correct. That's why I'm excited about this treatment.
Okay, so I'm hearing what you're saying about PMT and P700, and what would happen, Dr. Kim, if you blended the two products together?
That's a great idea. I don't regard these two products as competitor. They are just strong in its own area. But combining these two products, they are both safe. They are both helping greatly. Actually, a leader of Indian Diabetes Association advised me that, Dr. Kim, why don't you combine these two? Actually, that's
a good idea. Yeah. So stay tuned for future medical developments, potentially.
But I'm excited by this both treatment.
Right. So Dr. Kim, you've mentioned 6-Taste-T, PMT, and we've talked about P700 as well. Are there many other herbal formulations out there?
As I said, there are more than 2,000.
More than 2,000 individual herbs, and you talked before about how a lot of these herbs are actually toxic. So I'm curious then, so how can people then get more information on these herbal formulations that we haven't covered in the show today?
Before it was very difficult. Before there were not many information, but these days, situation improved. There are a lot of available already, quite available in the internet. So in the website we are introducing at the end of this show, we refer to those websites, and there are many very understandable, very well written papers how to use. Also, I mentioned this 7 criteria.
Right, you mentioned that earlier in the show.
With which we can guide through this 2,000 herbal treatments. We have to avoid certain widespread myth. All herbal treatments are safe? No. There are many fatally dangerous herbal treatments.
So this doesn't get a lot of airtime, what you're talking about, because it seems to me to be a widespread understanding that naturopathic or all herbal, all natural formulations are quite safe and benign. Well, you're saying that's not true.
That's not true. So what is not true either is that it is also wrong to believe that all natural treatments are not effective. That's also wrong. Some natural treatments are very effective, very good, but it's also wrong that all natural treatments are safe. No, some are very dangerous.
So you need